highly enriching and beneficial to all the participants here. So I will kindly request Dr. C.P. Sharma sir to take forward today's session. Sir.
Yeah. Okay. So first of all, thank you very much for the introduction. Am I audible to you all? Hello.
Yes, sir. Yes,
Hello.
sir. You are audible.
Okay, fine. Thank you. So first of all, a very good afternoon to one and all, to everyone. I wish to convey at the outset my sincere greetings to the chairperson of the National Commission for Homeopathy and the president of Homoeopathy Education Board for giving me once again this opportunity to share the important highlights of the CBDC curriculum of the homeopathic pharmacy subject. So I'm just going to share my PPT with you, and next. Okay, fine. So as we all know about the CBDC, that this is a competency-based dynamic curriculum introduced by the NCH under the Homoeopathy Education Board. So in today's session, I am not going to tell you all about the definition of competency or the is, because since last 1.5 years of this subject, homeopathic pharmacy, I believe firmly that all of you have become very well familiar and accustomed with this curriculum draft. So we need not to discuss in detail about the things which are already there in the curriculum syllabus. We are here to just sort out the confusions or to clarify the doubts, if any, and to further elaborate the syllabus which has been prescribed. So this is my effort for behind today's session. So competency, we know about the competency. So I will be quickly moving the slides, and I will be staying on only on the important slides which need further elaboration from my side, and the particular aspect of the curriculum which need exploration and elaboration from my side. To the next slide. This is the curriculum overview of the MD Homeopathic Pharmacy subject. We can see there are different 8 points. This is a uniform pattern among all specialties. Next, this is the official title of the course, HOM-PG-HP. This title is an official title of the specialty course, which is required to be used on all the question papers and answer sheets, mark sheets, everywhere. Then the components of the curriculum, we can see, we already know that there are MD home. In part 1, we have 3 papers, paper 1, paper 2, and paper 3. And similarly, in part 2, we have 2 papers, pharmacy part 1 and part 2. So I'm just quickly reading it out. Now, coming on the technical aspect of the curriculum, as per the Bloom's taxonomy, आप देखेंगे under the different topics and subtopics. In the first, we see under each topic, we see knowledge, skill, and reflection part. So I want to further elaborate those 3 points, knowledge, skill, and reflection, because we need to understand what is actually required to be done. So the next slide is knowledge, skill, and reflection. ये वाला इसमें computer screen में खोल दीजिए. Sorry. नहीं डेस्कटॉप है हाँ ये वाला वर्चुअल ये वाला पैकेट नेक्स्ट स्लाइड 7 नंबर sorry for the interruption next or next or next so here you can see that knowledge refers to the information concepts which you learn. You means the student learn. It is about understanding and recalling critical understanding regarding history of homeopathic pharmacy, different schools of medicine, and evolution of protein digestion. So knowledge part में क्या आता है? The student explains difference between crude drug use and demonstrating potentization procedure. This shows the skill of the student. Comparing pharmaceutic principles of different medical systems. This shows the skill of the student. He need to acquire and learn during his studentship. Then interpretation of pharmacopoeial standards. So this is the part which comes under skill. So similarly, like this, you see all the topics differently are given, and under them, knowledge, skill, and reflection part is given, respectively. And the reflection refers to the process of thinking critically about what you have learned. It is about analyzing, evaluating, and making connections between different pieces of information. So I have tried to give many examples which are coming in this more clearly about this aspect. Now, next technical aspect is Miller's pyramid. You must have known these 4 stages: knows how, shows how, and action. थ्योरेटिकल टॉपिक को एक कॉम्पिटेंसी बेस्ड फॉर्मेट में कन्वर्ट कर सकते हैं और उसे इंप्लीमेंट कर सकते हैं. लाइक in 4 stages, knows, number 1, knows. So knows means the student should know the definition of trituration, the purpose of trituration, the drugs requiring trituration. Examples: trituration is grinding of insoluble drugs. He should have knowledge about the trituration. Second phase is application. The student explains preparation of 1X or 1C trituration. So student should be able to explain why trituration is required and what ratio is used in decimal and different potencies. Then third stage is he has already learned. Now the student should be able to demonstrate weighing lactose and crude drug, grinding techniques using mortar and pestle. Example: student prepares 3x duration practically in the laboratory. So this part comes under shows how. So these are different competencies which the student is required to acquire and learn during his PG course. And the fourth stage is does. I'm just reconfirming. Am I audible to everyone?
Yes, sir, you are audible. Sometimes there is some disturbance. I think that it is due to some network issue. Doesn't matter.
Issue.
Sir, you
But
kindly
otherwise,
continue.
I'm audible. Okay,
Yes,
fine.
yes, yes, audible.
Okay. The fourth stage is does. That means the student is independently performing trituration in the pharmacy setup, whether in the hospital pharmacy or in the pharmaceutical industry. He is independently doing his work. The PG student is independently preparing triturated medicines during pharmacy posting. That means he has come now to the fourth stage, and this is competency based. That means there are two methods of teaching. As a faculty, we must understand that there are two methods of teaching. One is transmission mode and another is transformation. Transmission is just like a mobile tower is expelling signals, mobile signals to the tower, and all the handsets are receiving it equally. Whether the mobile is switch off or whether the mobile is under network, not under network. But we should not be teaching through transmission mode. We should be teaching through the transformation mode. We must ensure that through our teaching techniques or the learning methods, the student should be able to achieve the different stages of learning from knows to knows how, then shows how, and then finally he should be able to enact it. वो उसे perform कर सके. Next is
Yes, can you show the first slide?
which one? The trituration wala? This one?
Yes, sir.
Okay.
Yeah.
A few more examples are coming in the subsequent slides, which will give you further more and more clarifications about these technical terms and their implementation. So this was the first example with example जिसमें हमने competency के साथ उसका topic का mapping करके दिखाने की कोशिश किया है. Second example is mother tincture preparation. Knows. That means the student should know the definition of mother tincture, methods of preparation, listing of maceration and percolation methods. Knows how is he should be able to explain the preparation of mother tincture from fresh plant material. अच्छा होल्ड कीजिए उनको बोलो अलाउ कर दो भेज दो अंदर जो भी है. Okay, so shows how that the student should practically prepare a mother tincture in the laboratory, whether it is hospital pharmacy or in pharmacy lab or it is pharmaceutical industry. He should be able to practically prepare the mother tincture. That is his which competency shows how. Fourth is does. The PG trainee is handling medicine preparation in the hospital pharmacy or in the pharmaceutical industry independently. So during PG curriculum teaching, as a faculty, our target should be that right from the admission till the completion of the PG course, during the entire 3 years, we should see that 2, 3 and 4. So at the time of completion of the course, he should be at this level. Okay. Then next example is drug dispensing. So there are several examples. I will be very happy to share this PPT with all dear faculties who are connected here. So you can go through these slides in detail also even after the completion of this session. So I'm just quickly elaborating and moving ahead. This is drug dispensing, and then another slide for easy understanding. Here, इसको move करो next पे आ रही. Next, again next. Yeah. Another example, homeopathic pharmacopoeia. Student knows definition and purpose of pharmacopoeia. Knows how. He should be able to explain the preparation standards Yes, am I audible to you?
Yes, sir. Now audible.
Okay, thank you. So, does applies pharmacopoeia standard to dispensing. So, in homeopathic pharmacy, the Miller's pyramid, ये जो हम देखते हैं इसमें competency based जो educational term है Miller's pyramid का आपको follow करना है. So, from theory to understanding, understanding to practical demonstration, and finally independent professional practice. और इसी को हम लोग कहते हैं EPS, Entrustable Professional Activities, जिसकी फर्दर एक्सप्लोरेशन और इलॉबरेशन में आपको subsequent slides में दिखाना चाहता हूं. So please allow me to move to the next slides. This is entrustment. So you all know about this. So I will not be sharing it in detail because what is the definition of entrustment and what are the EPS given in the homeopathic pharmacy. You all are very much aware about this, but today we are going to discuss how to implement them practically in our teaching methods and in our laboratories. Next, definition of EPA, transmission method and transformation method. We have already discussed about this. These are very important for you to again quickly revise that there are different levels of EPAs right from level 1 to level 2, 3 and 4. And in the further, so sharing stop ho gaya, sharing chala gaya. I'm sorry. I'm just opening the PPT again. So there are different levels of each EPA. EPA level 1 means no permission to act. That is, the learner or the student is allowed to be present and observe, and he is not allowed to enact an EPA. So at the time of admission, when the student is a very fresh beginner, very fresh learner, and during this stage, we are not allowing him to enact, but he is required to be present and observe what is being done. Then EPA level 2, the student is allowed to execute the EPA, but with the direct supervision present in the room. EPA 3, the learner is allowed to carry out the EPA with indirect supervision whenever required, it is available. And EPA level 4, the learner is allowed to work unsupervised without the presence of the supervisor. And EPA level 5 is that he is now able to guide his juniors. So, अब आगे की slides में I will be able to explain you about these levels more clearly. These are different EPAs which have been given in our curriculum. You are well aware and familiar with these EPAs. Now I am coming on the practical and implementation aspect of these EPAs with few interesting examples. This is the table which has been given, which shows the mapping of EPAs with the domains of competency. You see, there are different levels of competencies. Next slide, please. These are the competencies: knowledge and scholarship, patient care, homeopathic orientation, communication skills, practice-based learning, and professionalism. Going ahead, this table you have seen, which is there in the curriculum. Against each EPA, we can see the different levels and semester-wise distribution. Next. Now, this slide is very important for all of us today because this is showing the practical implementation of the tables which are given in the curriculum. Please focus on this slide. EPA number 1, collect information necessary to ensure the quality, equality, and purity and stability of drugs by conducting a series of standardization tests to assess the role of a drug analyst in the homeopathic pharmaceutical industry. So our purpose of our PG education is that after the completion of the course, when the student is completing PG MD in homeopathic pharmacy, he should be able to perform this EPA. ये EPA को obtain करने के लिए, achieve करने के लिए उसको ये 3 years का कोर्स पूरा पढ़ना है इस EPA नंबर 1 के लिए. So domains of competencies क्या है? Number 1, case, knowledge and scholarship, patient care, homeopathic. So first I am talking about knowledge and scholarship. Now we are mapping this with EPA, like understanding principles of drug standardization. So to achieve this, to learn this EPA number 1, what is required? He should be able to understand the principles of drug standardization, pharmacognosy, pharmaceutics, quality control, and laboratory procedures. And this comes under which competency? Knowledge and scholarship. So he should be able to obtain the knowledge of standardization, pharmacognosy, and all these topics. Now, brief illustration or example, how it is to be done. The student explains methods for testing purity, moisture content, alcohol percentage, and identification of raw drugs used in homeopathic pharmacy. Similarly, patient care. To achieve this competency, we are mapping this with the EPA, ensuring safe, pure, and effective medicines indirectly supports patient safety and treatment outcomes. Example, student identifies contaminated mother tincture and prevents its dispensing to patients. So our course objective is this EPA number 1. And to achieve this, these competencies, different domains are required. And how it is mapped with EPA along with the example. This slide is just trying to show this. Next. इसमें आधार कार्ड दे दो. Yeah. Next, similarly, EPA number 2. EPA number 2 is provide medication related expertise, consultation as a homeopathic physician and as a part of an interprofessional healthcare team in homeopathic hospitals. Just a second, please. Yeah. So, knowledge and scholarship, applying knowledge of materia medica, organon therapeutics, and drug interactions. An example is student advises appropriate homeopathic medicine selection for fever based on symptom totality. So to achieve this EPA, these competencies are required, and how this competency is to be mapped with EPA along with example, it is given here in this table. Like this, another EPA. So this is just an illustration how to implement this, how to map this EPA with the domains of competencies. Next. Now, we all know that in MD Home Part 1 course, the first paper is Fundamentals of Homeopathic Pharmacy, and under this we have different 6 competencies or chapters. Next, under each chapter we have these sub-chapters or subtopics. Next, So I'm just quickly moving ahead because we all know this and we already have this printed in our curriculum draft. Next, this is for part 1 and part 2. Part 1, paper 2, Fundamentals of Clinical Medicine in Homeopathic Pharmacy. So here we should, the objective of this paper 2 or this subject, Fundamentals of Clinical Medicine, is that as a PG trainee or as a PG scholar of homeopathic pharmacy, yes, we should have a thorough knowledge about homeopathic pharmacy. But for the application of this knowledge is to be practiced in homeopathic pharmaceutical laboratory in the hospital pharmacy. But first of all, it is to be practiced and implemented in the clinic setup in the hospital. So the PG trainee is also required to have a thorough knowledge about the clinical medicine. So that is the objective behind this paper 2, that the clinical medicine and its fundamental knowledge should be revised during this PG course. And for this purpose, we have different 5 topics and chapters in this chapter. Next, in part 2, we have homeopathic pharmacy paper 1 and paper 2, and different sub-chapters and topics are written here. We already know this, so I am quickly moving ahead with subsequent slides. Course content. We already know this. Different topics are given. Course description. Yes. Today, I want to further elaborate this table also, because under this course description in this table, topic overview is given, learning outcome is given, learning methods, assessment, and domains of competencies. Under each chapter, under each competency, all these headings are there in this table. Next. Practicals. These are the list of practicals to be done in part 1 and part 2. Under activities, we already know that the institute or the Department of Homeopathic Pharmacy of the institute should have an MOU with any nearby college or available institute of pharmacy. We should be a recognized institute, and journal club meetings and posting in hospital pharmacy for 15 days. Next, these are the different activities for part 2, like internship training, which is very important, because जो competencies हमें अचीव करनी, जो EPA के levels अचीव करने हैं, EPA level 1, 2, 3 and 4. So ये EPA levels अचीव करने के लिए pharmaceutical industry का exposure as an internship is very required for the PG training, the duration of which is 1 month. So whatever he has learned in the theory part, or he has observed in the hospital pharmacy, or he has observed in the pharmacy laboratory of the college, he should be able to observe, enact, and perform the same tasks or competencies in a pharmaceutical setup also. So that is why this provision of 1 year internship in the pharmaceutical industry has been kept here for the PG training. Next, please. Assessment part. In many of the colleges and the universities, MD Home Part 1 examinations, university examinations are already over or undergoing. So we are well aware about this assessment pattern. But in the coming slides, I will also be sharing with you all the sample question papers duly aligned with the competencies and the curriculum, prescribed curriculum. This is the marks distribution for theory and practical part. for all 3 papers for MD Home Part 1 exam. Next, the distribution or the arrangement of the questions in the question paper. One question of 20 marks, 4 questions of 10 marks each, and 8 questions of 5 marks each, thus coming to 100 marks question paper for MD Home Part 1, paper 1 also, and paper 2 also, same distribution. Now this is the question paper layout. मैं आपको अभी क्वेश्चन सैंपल क्वेश्चन पेपर में बताऊंगा कि किस तरह से इसको इंप्लीमेंट करके हमने क्वेश्चन पेपर सैंपल बनाया है. Application question number 1 should be a 20 marks question, and that question particularly should be selected from these chapters only, from these topics only named here. Similarly, all types of questions, LAQ, SAQ, they are to be selected preferably from which chapter it is given here in this table. So this is for the question paper setters under different universities. This table will help you how to select the question paper, how to draft the question paper. This is question paper layout for paper 2. Similarly for paper 1 and paper 2 of part 2 also. Now, this is just an assessment blueprint for the practical and Viva examination of part 1. We already know that for paper 1 and paper 2, there is a common practical exam. So this is the bifurcation of the practical or Viva examination for part 1. We know that 100 marks are given for Viva. What is the breakup of Viva? It is given here. Next, similarly for part 2, it is already there in the curriculum and the syllabus. So I'm just quickly moving ahead. We are already aware about the term test during 6th month and 12th month, and then final exam at part 1. Similarly for part 2 at 24th month and 30th month of training. 2 term tests are there. This is for part 2. We have already discussed about this, so I'm moving ahead. Distribution of topics for theory-based assessment. Distribution of questions from to be selected from which topics. Next. These are different index, appendix are given. Next. These are different dimensions of clinical competencies. Schedule. ये इसकी अभी जरूरत नहीं है हमें, इसलिए मैं इसे आगे मूव कर रहा हूँ. Different LAQs examples are given. Sample question paper. Homeopathic pharmacy. Reflective. Yeah. So now, as you can see in the curriculum, that under the topic HOM PG FHP 01, the first topic, which is named as Philosophy and Development of Homeopathic Pharmacy. So in this table, you can see learning methods are given. In the table itself, learning methods are given. So I am hereby I am just trying to give you an elaboration about the learning methods, because it is just written there that reflective learning. But what does it mean? And apart from learning methods, assessment and competencies and learning outcomes are mentioned. So these forthcoming slides are just the elaboration of those points. Reflective learning. So under this topic, what do we mean actually by the reflective learning? Reflective learning helps students critically analyze historical concepts, pharmaceutical principles, and evolution of pharmacy. Examples: student reflects on how Dr. Samuel Hahnemann developed the concept of potentization after observing drug effects. So ये इस reflective learning का part है under this particular topic. Another example is reflective discussion comparing pharmacy practices during Hahnemann's era and modern pharmacopoeia methods. Practical reflection example. Students analyze how the introduction of potentization reduced toxicity and improved therapeutic application in homeopathy. Next slide. Library-based learning. आप देख सकते हैं. Under this topic, these learning methods are given. So these slides are just trying to elaborate those points. That what does it come? What does it include actually? Library-based learning is your students prepare seminar presentations after reviewing literature on development of potentization, evolution of homeopathic pharmaceutics, and contribution of pioneers in pharmacy. So this will come under your library-based learning part, which is a learning method given in the curriculum under this particular chapter. Next, then इसी table में you will find the assessment methods are given. Continuous programmatic assessment. So what does it mean actually? This slide is elaborating that point. Continuous programmatic assessment is nothing but your seminar presentations on development of homeopathy pharmacy. So you are asking your student to present a seminar on development of homeopathy pharmacy. This will come under this learning method, assessment method, continuous programmatic assessment, which is an assessment method. So under every topic, different learning methods are given and different assessment methods are given. How it is to be implemented, I am trying to just show to you through these slides. Assignments on different schools of medicine. आपने अपने PG training को एक assignment दे दिया. You just prepare a seminar on different schools of medicine. एक assignment. और उसको आप assess कर रहे हैं. Reflective journals regarding potentization concepts and viva during practical discussions. And on these assignments, you are conducting a viva examination. So this is coming under assessment tool. Then comes written assessment, which is a ACQ. It is written there. You can see. If not under this topic, then maybe in some other chapters or under some other topics, under the assessment methods, you will find this technical term ACQ. So what is ACQ? How it is to be conducted? You can see here with the help of an example. Like structured ACQ is structured essay question. Example, explain the evolution of potentization and its significance in homeopathic pharmacy. Then LAQ, example is given. Discuss the development of homeopathic pharmacy from Hahnemann's period to modern pharmacopoeia practice. And similarly, for SAQ also, define potentization, enumerate different schools of medicine. So in the assessment methods, there are different things: continuous programmatic assessment, SEQ, LAQ, SAQ. All the examples are given here, which will be shared with you all. This PPT will be shared with you all after the end of this session. Next, practical assessment. Similarly, examples are given. Demonstration of succussion technique. The student should be able to demonstrate how the succussion is to be done. Identification of pharmacy instrument. This is also a part of the practical assessment, जो हम लोग spotting या करते हैं practicals में. Comparative analysis of old and modern pharmacy method. So under each topic, the learning methods are given. Similarly, the assessment methods are. We as a faculty members, it is our responsibility to decide which assessment method is more appropriate for this topic. Which learning method is more appropriate for this topic. Learning methods. Now, under some topics, under some chapters, you can see that a few more learning methods are given, like CBL, PBL. So what is case-based learning? This is just an illustration, an example, which is there in front of you in this slide. Case-based learning. clinical cases related to pain, fever, diarrhea, jaundice. So there may be different clinical conditions which are there in the syllabus under the part 1, paper 2, fundamentals of clinical medicine in homeopathy pharmacy. So under each clinical condition, the student is required to learn each clinical condition, and under each condition, to learn that particular condition, what are the learning methods? Case-based learning. What does it include? It includes pathophysiology of that particular condition, Hahnemannian classification of symptom, miasmatic interpretation in relation to that particular clinical condition, and correlation with homeopathic pharmacy and remedy preparation. अभी हम आगे के एग्जांपल्स में इसको और इलॉबरेटिव वे में समझ पाएंगे. Similarly, problem based learning, the students are given clinical scenarios. ये हम स्टूडेंट्स को हॉस्पिटल ड्यूटीज में भी करवाएंगे और साथ में एग्जामिनेशन टाइप पे भी करवाएंगे. प्रॉब्लम बेस्ड लर्निंग, like different clinical condition like a chest pain or acute confusional state or a condition of dyspnea. So the students are given clinical scenarios and then they are required to learn what is the pathophysiology of this particular clinical condition, what is diagnosis, how this condition is diagnosed, symptom hierarchy kya hai, what is the miasmatic background behind this particular clinical condition on the patient, and based on this condition and based on the homeopathic principle, how the medicine is to be selected and to be prescribed. Bedside teaching and deliberate practice. The examples are given. PPTs will be shared with you all. So I am moving ahead. Continuous programmatic assessment includes all these points. Daily clinical performance, case presentation, bedside viva, symptom analysis exercises, problem-based learning discussions, clinical logbook maintenance, and short clinical assignments. These are different. Under each topic or chapter in the table, in the bottom, you can see the assessment tools also. And under assessment tools heading, you are finding certain technical terms, the checklist. So what does it include? Rating skills. In the regulations, we have already, in the curriculum, we have different rating skills. And these are SAQs, certain SAQs, short answer questions. These are just examples of SAQs. Next. Objective structured clinical examination. Under certain chapters, we are also seeing this technical term, OSCE. What does it include? ये जो new slide में include किया था वही है. So this includes clinical examination skills, symptom elicitation, Hahnemannian classification of symptoms, miasmatic interpretation, clinical reasoning, etc., etc. Now, इसको correct नहीं किया था यार, वो वाला कहाँ गया? इस नाम से था. अपर्णा में क्या? हाँ नहीं, एक मिनट, इसको चेंज किया था ना. अपर्णा को बोला, जस्ट अ मिनट, होल्ड ऑन. डॉक्टर अपर्णा को बोला, जस्ट Okay. Yeah. So sorry for the interruption. Actually, I was searching for this slide, and which means so this is just an illustration example of this one is screen coach OSCE skin lesion examination. Are you able to view this slide? Hello, am I audible to you?
Yes, sir. Audible.
Okay, 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 fine. मुझे मोबाइल में देखो नहीं ये पीपीटी मोबाइल में खोल रहा हूँ Okay, so through this slide, we have tried to show you an example of OSCE with the help of this checklist. And the example is of skin lesion examination. So you can see, are you able to view this slide clearly?
Yes, sir. Clear.
Okay, so introduction. Introduce yourself to the patient, including your name and role. Confirm the patient's name and date of birth. Briefly explain what the examination will involve using patient-friendly language. Explain the need for a if the skin. Okay, so these are different points which come under introduction. Then comes general inspection, close inspection, assessment of a pigmented lesion, and finally systemic examination. So this is just an example of a skin lesion examination, which comes under OSCE part of the assessment. Next. Okay. Then comes after OSCE comes the DOPS, direct observation of procedural skills. It is a workplace-based assessment method in which the teacher directly observes the student performing a clinical skill on a real patient and provides immediate feedback. So this is useful during bedside teaching, OPD, IPD postings, clinical case taking, examination procedures, and symptom analysis. So the student is performing a particular given task and he is observing and he is performing. So these are different templates which are given in the logbook, student logbook, under the heading direct observation of procedural skills. So different gradings as per the observation are given and date wise it is to be recorded along with the strength and the area of improvement. Next. Simple question paper दिखाए Now I'm going to share with you the sample question paper in alignment with the curriculum and all the competency-based points. Please allow me 1 minute to open the respective file, the PDF of the sample question paper. This is, first open the paper 1. Paper 2. So in front of us on the screen, now we have the paper 2 of MD Home Part 1 course. Okay. So अच्छा इसमें वो वाली स्क्रीन खोल दो, वो इसका प्रीवियस स्लाइड खोल दीजिए जिसमें क्वेश्चन पेपर का पैटर्न है। ये वही वाली स्लाइड खोल दीजिए। नेक्स्ट 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 पार्ट 1 का डिस्ट्रीब्यूशन ऑफ क्वेश्चन पेपर। हाँ, और आगे 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 चलिए और आगे, बस हाँ दे और आगे, नेक्स्ट नेक्स्ट नेक्स्ट, स्टॉप स्टॉप। So kindly refer to the curriculum where the question paper layout is given. On which page? Page number? Page number. Question paper layout is given for part 1, paper 2. 71 page. On page number 71. On page number 71, you can see the question paper layout which is given for part 1, paper 2, which is fundamentals of clinical medicine in homeopathic pharmacy. So under this table in the curriculum, you can see question number 1 should be an application-based question, for example, and content case-based question with application to homeopathic pharmacy. And it should be of 20 marks. So here in the question paper, you can see the problem-based question or is given a homeopathic hospital pharmacy notices inconsistent results in chronic conditions like arthritis and eczema. Some patients improve while others do not. On review, it is found that treatment is mainly based on personal experience rather than scientific evidence. Therefore, the hospital decides to adopt evidence-based practice to improve consistency, reliability, and treatment outcomes. In this context, answer the following. Define the concept of evidence-based practice. Describe the core principles of evidence-based practice. Now coming to question number 2. In the layout, you can see that 4 questions. Question number 2, 3, 4, and 5 should be LAQs, and these questions LAQs should be selected from the given chapters, and these questions should be of 10 marks each. So here in this question paper, you can see the section is given 10 into 4, 40 marks. And these questions are selected from the relevant chapters only. Discuss guidelines of good clinical practices for clinical trials in homeopathy. Question number 3, what is FACR? Question number 4, what is shock and its types and causes? And discuss the scope and limitations of homeopathic pharmacy in the management of shock. And define jaundice and explain its pathophysiology, and explain the role of homeopathic pharmacy in drug selection, preparation, quality control in management of jaundice. So in this way, this is the correlation or the implementation of the curriculum in the question paper format. That means fundamentals of clinical medicine, which is define jaundice and explain its pathophysiology. So students should be able to learn and write here what is jaundice and what is the pathophysiology of jaundice. But at the same time, this should be correlated with the knowledge of pharmacy also. That is why it is named as fundamentals of clinical medicine in homeopathy pharmacy. That is, evaluate the role of homeopathic pharmacy in selection of drug, selection of methods of preparation, selection of potency, and quality control in the management of jaundice. Next question. Question number 7. What is anemia? Mention its causes and explain the role of posology in homeopathic pharmacy for its treatment. The anemia is to be treated. Then what is the role of posology in this? What type of potency is required to be given in cases of anemia in different patients of different ages? Now, please open the paper 1. Another simple question paper. इसके नीचे वाला जो है next this one. Yeah. So similarly, for part 1, paper 1 also, the layout is given in the curriculum. And in accordance with the layout, the question paper is required to be composed. An example of which is in front of you now on the screen. On page number 29 in the curriculum, it is given the question paper layout, which says that the question number 1 should be a problem-based question and it should be of 20 marks. You can see on the question paper on the screen. It is a problem-based question. A homeopathic manufacturing unit is reported for poor quality medicines and contamination issues. On inspection, it is found that safety rules during drug preparations are not strictly followed by the staff. In this context, answer the following. What are the essential safety rules to be followed during preparation of homeopathic medicines? So these are the problem-based question. This is 20 marks question. Coming to the next LAQ type of question. Write in detail about the history and development of homeopathic pharmacy. In the layout, it is given that question number 2 should be from chapter 1 or chapter 2, which should be a 10 marks question. Here in the question paper, you can correlate the exact implementation of the layout in the form of a question paper. The third question should also be a LAQ to be selected from chapter number 4, a 10 marks question, which is explain the concept of toxicological dose and toxicological action of homeopathic drugs. Similarly, all 13 questions are selected in accordance with the layout which is given in the curriculum. So with this presentation and all these different various illustrations, examples, specimens, my purpose was just to show to you all that how the curriculum which has been prescribed, it is to be implemented in the practical aspect, in a classroom or in a laboratory or in the hospital pharmacy or in the hospital OPD, in the hospital IPD or in the pharmaceutical industry. All those points are to be implemented and executed in the proper way as they have been prescribed in the curriculum. So I have just given my sincere effort to express this to you all. Now I would like to, I would be very happy if I get the questions from the audience. Then I will be able to, I will try to sort out the queries right here, right now, or maybe if the NCH and Homeopathy Education Board permits me through your questions. I will be very happy to receive your questions on my emails, and then I will be trying to resolve them one by one. And as I have already committed, this PPT will be shared with you all so that you can, supposingly, if you अगर आप कोई slide इतना minutely properly नहीं देख पाए होंगे तो आप इसको thoroughly बाद में भी देख सकते हैं. Any questions, please, from the audience? Dear faculties, dear participants, any questions? Okay. PPT will be shared. Here we can share the PPT. Huh? I can share. No, not sharing. Okay. The PPT will be shared by email, or I will be sharing my PPT to Homeopathy Education Board, and from the board it can be sent by me email to all the colleges. I respect the convener or coordinator of this meeting to please conclude the session or start the question answer session if required.
Okay, sir. Any more question from any faculty? Any Any more query?
Herbarium journal का तो हमने नहीं दिया ना marks इसमें. Yes, I have one question. I got one question in the question box. The answer to which is no. For particularly for herbarium and journal, no marks are to be given for the practical examination. And whatever the distribution of marks is there, it is already given in the curriculum. Apart from those points, बाकी किसी में marks की allotment की जरूरत नहीं है. Any other questions, please?
Okay. So, thank you, sir. We
Hello,
heartily
sir.
thank you. Yes, yes, madam. Yes.
In every
Sorry, we are unable to hear you.
sir, in FCM number second chapter is there, no, sir. It is not reflected in question paper layout.
Please repeat your question, ma'am.
In FCM second chapter is there, no, sir. Home HP PG FCM HP 02.
अच्छा एक मिनट में I'm just opening in paper 1 or paper 2?
Paper 2, sir. Part 1, paper 2, FCM.
FCM, okay.
So FCM HP 02. Second chapter has been not reflected in question paper blueprint.
Paper 2, na? Okay,
Yes,
under
sir.
FCM, which chapter? FCM HP 01?
02.
02.
02. So what is your question in this regard?
That is not reflected in question paper blueprint, no, sir.
Do we have any questions in question paper?
In the question paper blueprint or layout?
Layout, sir.
Okay, fine. Now I have understood your question. Actually, it is not practically possible to include every chapter in the examination or in the question paper. You see, but this is just an example or illustration. So
Okay.
there are different topics, different chapters. So questions are only 13. So it is not necessary that we will be able to cover each and every chapter and we can select question from all the chapters. So when we prepared this layout, some chapters were missed, but we have tried that at least the important chapters should be covered in the question paper.
Okay, sir.
Okay.
And
Yeah.
regarding herbarium, sir, it has been not reflected either in part 1 or nor in part 2. Whether we should ask our students to prepare or
No need, because actually in the undergraduate course, this is usually
Okay.
done. So for at PG level, this is not required to be done.
Okay, sir.
Which one? So besides these, if any other questions are there, I would like that the questions, if the questions come to us through emails, then I will be more happy to answer all the queries, all the questions in a more elaborative manner, and of course along with the examples.
Yes, sir. Sir, it has been decided in Homoeopathy Education Board (NCH) that
Sir.
whatever queries or questions or any type of doubts or suggestions, whatever the
Yes.
faculties may give, please send us to the Homoeopathy Education Board email. We will
Yeah.
work on it. We will work on it, and obviously this training session is the beginning. And there will be more interactive training sessions. I suppose that
In
more
the
and more
future also.
discussion will bring up more and more clarity. Sir,
Definitely.
today, sir, we heartily thank you for your dedication and the time and effort you have given for such a wonderful training session. We also thank all the participants, and we expect again to meet for any further improvement, whatever we can do from the end of the Homoeopathy Education Board and National Commission for Homeopathy. So, ending up this session, sir, thank you so much.
Okay.
And
Thank
our
you, sir.
heartful thanks to you, sir. Regards. Thank you. Thank you, sir.
Thank you, sir. Thank you, everyone. Namaskar.